I'd like to review a few ways of implant planning for 2 implant overdentures. The majority of overdentures that you will restore are 2 implants in the mandibular arch, which are retained by implants but supported by soft tissue. So you must make sure that you are fabricating an ideal complete denture to provide the support and stability. The implants only provide retention. You'll want to make sure you go through border molding. When you get your plan done, you will receive a denture that has space for the housings. So there will be holes in the denture where the attachments will be picked up. So what we need to do is figure out how to communicate to the lab so that we get the implants in the correct position. Once you attach them, you can change out the retention. This is going to be a blue retention, and you will see that there's an inside component, and that's going to replace the internal retention, and there's also an external component to retention. And you want to make sure you pick these up correctly so that you don't get it locked in, or it will make you very sad, like this denture. All right, so let's talk about the techniques. The first technique is going to be the original kind of analog technique where you duplicate the physical denture. To do this in the dental school, we assemble a putty flask, which is made out of a dental laboratory putty. Here we use the Coltine. You can also use Siltec or any other dental lab putty. You measure out 4 scoops for the bottom part of the flask and the appropriate amount of activator or catalyst, which is the blue stuff here. Mix it thoroughly until you have a uniform color and you don't see any streaks or kind of splotchiness. And then you will adapt the intaglio of your mandibular denture into that putty patty, and that will create your putty cast. It sets in maybe 10 minutes or so, and you'll cut away any excess that's locking the mandibular denture in. So you're basically freeing it up. Please be careful with your scalpel blade. I don't want any injuries or incident reports. So you'll end up with a cast that looks like this. So this is your putty denture cast or your putty denture base that replicates the intaglio surface. And now you're going to make a cap that fits over it to capture the cameo. You want to cover the whole thing with Vaseline, mix the same amount of putty, and make a little dome or a hat over that original putty patty. And if you used indices, you want to make sure those get locked in with the putty. So once it's set, same thing, about 10 minutes, you'll be able to peel away the upper and lower parts, and you'll end up with a space in your cast. You'll fill that in with some acrylic resin. In this case, we use the BioCryl X, which is radiopaque. And you mix up the powder and liquid, the monomer polymer, until it's runny. And then when it's that stringy stage, you pour it into the putty flask that you created and put the 2 pieces together. That takes a good 15-20 minutes to set. And once you do that, you separate the 2 pieces of the flask and you end up with this. This is a happy face with a acrylic duplicate of your denture. You will invariably have some excess, so you'll take your e-cutter, take it to the lathe, and just polish around the edges so that you have something that looks like a complete denture with no sharp areas. You want it to be smooth to the touch, just like with anything you make for complete dentures, so that you don't traumatize your patient's mucosa. After this, you're going to turn that into the surgical guide. So the patient will wear that in the CBCT scan, and so that will be step 1 of planning. You'll use that same guide afterwards for the implant surgeon. And you'll open a window on the lingual and a window on the buccal. The window on the lingual allows them to guide the implant placement. The window on the buccal allows the surgeon to visualize that it has been seated. So let's talk digital. You can also scan and 3D print a duplicate of your denture. So same thing, if you have the STL design, you can request a reprint in a clear resin. Otherwise, if you want to scan the patient's denture, if they come in with an existing denture, you can get a clear duplicate. Either the analog or the digital print will look like this, and you'll see you've opened the window lingual to the incisal edges, so the implants will be placed a little lingually, and that will give you room for your locators and housings. And that's how you would use it for the surgical guide. You can also, rather than duplicating it in the radiopaque resin, you can also use fiducial markers or little stickers when you do your dual scan CBCT. And this is one example of those. And this would be on the maxillary if you're planning maxillary implants. If you're just doing a mandibular overdenture, you'll only place them on the mandibular. This is a screen grab from pocketdentistry.com, not a sponsor. And you can see that you'll do 2 different CT scans, one with a denture in, and then you'll do a separate CBCT of the denture by itself. And then you can merge that data together by lining up where those little radiopaque stickers are. They create those little white dots with the little pegs that stick out. So I hope that helps explain a little bit, and reach out if you have any questions. Thanks.